you test cranial nerve number 11. So we're gonna first go ahead and turn left, turn left, right, turn up, down. Awesome. And can you, now that I add some resistance, turn my other way, please? Awesome. Great. So, and now shrug your shoulders up. Awesome. So cranial nerve number 11 is intact. And before I forget, we have to auscultate her lungs and her heart. So we're going to first begin with the lungs. And I'm going to go ahead and start with the bronchial. I'm going to go ahead and start with the bronchials. So breathe in and out for me. Okay, then vestibular bronchial. Vestibular. Awesome. And now lung sounds are clear and there's no adventation sounds detected. I'm gonna go ahead and do her posterior lungs. So I'm gonna start off again with bronchovesicular, bilaterally. Awesome. Thank you for breathing in and out. The vesicular. Awesome. And there is no adventation sounds detected. And now I'm going to go ahead and test for how evenly her chest rises. So go ahead and breathe for me. Great. The patient's chest rises evenly. And now I'm going to go ahead and detect the CVA tenderness. Just let me know if this hurts or any tenderness.
Nope. Nope.
Awesome. There is no tenderness bilateral of the CVA. And I'm gonna now go ahead and do the apical pulse. And for the apical pulse, I'm gonna go ahead and put my hand on the base and the apex. We're able to palpate it, but not able to visualize it. And it's located in the left intercostal, fifth intercostal mid-clavicular line. And it is also +2 before we get you moving. So let's start with the heart. We're gonna start on the right aortic, first intercostal or second intercostal. Go ahead, breathe for me, thank you. Oh, you don't have to breathe. Next, we're gonna go ahead and do the left second intercostal pulmonic. Then we have the third intercostal Erb's point. Then we have the fourth intercostal tricuspid and the fifth intercostal mitral, yeah, the mitral valve. And next I'm gonna go ahead and do it on the other side, so using the bell. So plug this back in, I can't hear very well, so I always take this out. So I'm gonna go ahead and do against the aortic, the pulmonic, Erb's point, tricuspid, and mitral. And there was presence of S1, S2, no murmurs detected, and no presence of S3, S4. So now that we have done with mostly all the upper body, unless I forget something, we'll go right back. We're gonna get you on the floor. We're gonna go ahead and start with the abdomen. So I'm gonna go ahead and first I'm just gonna inspect the abdomen and see, inspect for its contour, any piercings, so there's no piercings. The umbilicus is midline and inverted, as well as the body contour is round. Now I'm gonna go ahead and auscultate all four quadrants. I'm sorry, I'm gonna warm this up for you. Okay. Awesome. And bowel sounds are normal. There is no hyper or hypoactive bowel sounds. Now I'm gonna go ahead and percuss. Do you have any pain?
No.
Great. So I'm gonna go ahead and percuss all four quadrants. Sorry for my cold hands again. I try to warm them up. There is general tympany in all four quadrants, as well as dullness in the liver and the spleen. There's no evidence of organomegaly, splenomegaly, or hepatomegaly. So now I'm gonna go ahead and just palpate the abdomen. Let me know if it hurts. Sorry about my cold hands again. There is no tenderness to touch and no pain detected. So we are done with the abdominals, but we're gonna keep you laying down and go ahead with your hips. So now to test the range of motion with her hips, I'm gonna have you extend your leg. Awesome. And go right back down, flex. Awesome. And now I'm gonna have you adduct your leg out. abduct your leg and then adduct it back in. I'm gonna have you invert your leg. I always do the opposite, so exvert, invert, awesome. We're gonna do the same thing on the other leg. Extend, flex, yes, abduct, invert, exvert, awesome, thank you so much. And now I'm gonna go ahead and apply some resistance to it. Can you please adduct for me? And can you please adduct for me? Same thing. Wait, yep. Abduct for me and then adduct for me. Great. So the range of motion for the hips is full range of motion as well as 5 out of 5 strength. So now you're able to stand up again and we're gonna move up. Have a seat. I can place this down. And I'm gonna go ahead and have you go ahead and flex your knees back, good job, and extend them out. And I'm gonna hold this and have you hyperextend. Awesome. And now I'm gonna go ahead and have you go down, the other leg, and now raise them both back up. Awesome. And now with this full range of motion in the knees with 5 out of 5 strength present. Now we're gonna move down to the ankles. I'm gonna have you invert your ankles, exvert your ankles. I'm gonna have you tip, point up, point down, gas pedal, and now I'm gonna go ahead and apply resistance to it. So go up, down, awesome. So the ankles are showing 5 out of 5 strength and full range of motion. So now we're gonna go ahead and go up and do her shoulders. So I'm gonna go ahead and have you flex bilaterally. Awesome. I'm gonna have you extend and circumduction. Awesome. Full range of motion is present in the shoulders. I'm gonna have you now adduct out with some resistance and adduct in. Awesome. Now bilaterally and back in. Awesome. So bilaterally 5 out of 5 strength. So now we're gonna do the elbows. I'm gonna go ahead and have you do this movement and now back out. And now I'm gonna go ahead and put some resistance on. So go up and back down. Awesome. So the elbows are full range of motion and 5 out of 5 strength. Now we're up to the wrists. So we're gonna go ahead and do, can you go ahead and make this movement? Go back, extend or flex, extend, and then hyperextend. And I'll do that with some resistance. Can you go ahead and flex? And now go ahead and extend. Awesome. And so 5 out of, or this way, so I can go down now. Sorry. And so, yep, so 5 out of 5 is strength and as well as full range of motion in the wrist. Next, I'm gonna go ahead and do the hands. And so for the hands, go ahead and make a fist. Open up your fist, spread your fingers. Awesome. Now please go ahead and press down on my fingers. Nice. We have 5 out of 5 strength and full range of motion in the fingers. So now we are done with the range of motion. Give me your hand. Let me know if there's your fingers are up or down.
Up, down, up, down.
Awesome. So patient has appropriation in their fingers. I believe that's what it's called. And if it's not, you know what I mean. And next, I'm gonna go ahead and keep your eyes closed. I'm gonna do the paint to touch. Go ahead, let me know if you're able to feel this. This is soft.
Yep.
Just touch.
Yes. Yes.
Awesome.
Yes.
And now I'm gonna do something a little sharper that has more feeling to it.
Yes. 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 Yes.
Awesome. So the patient has cortical sensation to both touch and pain. So I'm gonna go ahead now and move on to keeping your eyes closed. I'm gonna want you, give me your palm. I'm gonna go ahead and draw a number and tell me what number it is.
1.
Awesome. And now I'm gonna go ahead and put something in your hand and you tell me what it is.
Paperclip.
Awesome. So the patient has her sensory function, her sensory function is intact, and she is able to detect the number and object that is in her hand. So now I'm gonna go ahead and move on to another test. That's gonna be testing her cerebellum function. So I'm gonna start off by alternating hand movements really fast. Awesome. And now we're gonna do the hand to nose, or tip my nose and her finger, you know, fingertip to finger, there you go. Okay. Nice. And the other hand. Nice. So the cerebellum function, and now one last thing is the shin, heel to shin. So go ahead and put your heel on your shin, go up and down, bilaterally. Awesome. So the patient has been able to successfully go ahead and perform the cerebellum function that is intact. So I'm going to have you go ahead and look at the curvature of your spine. Can you go ahead and touch the tip of your toes? Awesome. So while I do this, the spine has a normal curvature. There is no, let me know if there's any tenderness or pain when I do this. Okay, there's no tenderness to pain. And now I'm going to go ahead and see that the cervical and lumbar are concave and the thoracic is convex, which is a normal finding. Go ahead and stand straight back up for me. I'm going to have you now look at the side of her, and there is no evidence of lordosis, scoliosis, or kyphosis.
And your neck. I'm going to just start at the top of your head. I'm going to have you uncross your legs. I'm just going to look at the top of your head. I'm just looking at your hairline. You don't have any balding, which is great. The shape of your head is symmetrical. You don't have any scarring that I can tell. Do you have any scars on your head?
Not that I know of.
Any traumatic incidences? Car accidents, anything like that?
No.
Okay, perfect. All looks great. There's no masses, lesions, anything like that. I'm next going to start with your eyes. I'm going to start by doing checking your eyes. Do you wear glasses at all?
No.
Okay, perfect. So this is called the smelling chart. I'm going to stand 6 feet away from you, and I'm going to have you read the line that you can, the lowest line that you can see, and I'm going to have you cover your left eye first.
Bottom, LTFPH.
Awesome. Okay, cover your right eye.
LTFPH.
Awesome. And then both eyes.
LTFPH.
Awesome. You have great vision. That's 20/20 for both eyes. I'm going to just inspect your eyes. I'm going to have you look up at me. Your eyes look good. I'm going to touch your face and just kind of pull down right here. Everything looks really great, nice in color. No abnormalities or drainages. I'm next going to, my pen light is in my pocket. I'm going to have you, I'm going to check your eyes, your pupils, and just look right at my nose. Perfect. Awesome. They're both reactive to light. That's great. I'm going to have you follow my pen with just your eyes, so not your head. I'm going to go up this way. Perfect. Down this way. And this way. This way. And this way. And this way. I'm checking cranial nerves 3, 4, and 6, and that was great. I'm going to grab my little instrument here and screw this together. I'm also going to place my hand on the side right here, and I'm going to have you look over at this hand. Perfect. And then look over at this hand. Awesome. I'm going to have you follow the edge of my pen. I'm going to bring it to your nose. I want you to tell me when you see double vision. So coming in closer, just looking right down there, the tip of the pen. Okay? Do it one more time.
Yep.
Awesome. And one more time.
Yep.
Perfect. Okay, I'm going to check your visual fields. I'm going to have you cover your right eye. I'm going to have you look just right at me. I'm checking your peripheral vision, and you can tell me what number I'm holding up.
2.
Awesome.
1.
Okay.
2.
And
1.
awesome. Okay, switch eyes. And
2.
okay. eyes?
2, 1, 1, 2.
Awesome, good job. Okay, I'm gonna turn this little light on. It's gonna be a bright light. I'm gonna be checking the insides of your eyes. So I'm gonna start on the right side with my right eye. And I'm gonna start out far and then I'm gonna come in close. Right here. I'm checking your optic disc and your reflection, and all looks great. I'm gonna come in on the other side. I'm gonna start a little farther away. And I'm gonna come in close. Checking the same thing on this side. And that looks great. Excellent job.
Thank you.
Okay, we're gonna move on to your nose. I'm gonna switch my little cap to the top of my instrument out. I'm going to start just by looking at your nose. Go ahead and look straight at me. Your nose looks nice and straight, symmetrical. I'm going to palpate your sinuses. Does that hurt at all? Work my way down. That have any pain right there?
No.
Okay. Now I'm going to take a look up your nose. I'm going to have you tilt your chin up. I'm going to pull your nose back. I'm going to take a look at your mucosa, your turbinates on both sides. Looks nice and pink in there. No discharge. Looks great. I'm going to have you close one side of your nose with your finger. I'm going to have you sniff in, breathe out. Do it with the other side. And out. And both off and breathe in. And breathe out. Okay, I'm going to have you close your eyes. I'm going to hold something in front of your nose and I'm going to have you sniff it and tell me what it smells like. This is a pretty common smell. You smell that?
Coffee beans.
Coffee beans. Good job. Okay, perfect. Okay, I'm going to move on to your ears. I'm going to have you cover one side of your ears. I'm going to whisper something in your ear and I want you to tell me what you hear.
Apple.
Okay, other side.
Baseball.
Awesome. Okay. I'm going to use my tuning fork right here. I'm going to do 2 different tests. And I want you to tell me if you can hear it on both sides of your ear or one side or the other side, okay? Can you hear it on both sides?
Both.
Awesome. Okay. So I'm going to put this back behind your ear. I want you to tell me when you stop hearing it. Okay? Now can you hear it? Can you hear it? Okay. Excellent. We're going to do the same thing on the other side. When you can stop hearing it.
Huh?
Okay. Can you hear it there?
Yep.
Awesome. Okay, I'm going to just take a look inside your ear. I'm first going to palpate. Is this causing you any pain on this side?
No.
On the outside of your ear?
No.
Now on this side?
Nope.
Okay, I'm going to take a look inside your ear. Looking at your tympanic membrane. Looks nice and shiny. Pearly color. That's what we like to see. Same thing on this side. Looking at your tympanic membrane. Looks nice and shiny. No redness, pearly in color. Your cone of light looks great. Okay. I'm going to move on to your mouth, your throat, and your face. I'm going to just start by looking at your lips for any dryness or sores. I'm going to have you open your mouth. I'm going to shine my light nice and wide. Go ahead and stick your tongue out for me. Looking at your tonsils, they look equal in size, no redness. I'm going to look at your soft palate. Go ahead and relax your tongue. Go ahead and open your mouth again. I'm going to just take a look at all your teeth. They all look great. Excellent. Go ahead and stick your tongue out for me again. Just normal. Yeah, perfect. Looks normal in size. I'm going to have you go bring your tongue this way, and up and down. Awesome. Great range of motion. I'm going to look underneath your tongue at your salivary ducts, which they look great. No masses or anything like that. Okay, I'm going to move on to your neck. I'm going to check for flexion and extension. So go ahead and tilt your head back and forth. Good job. Now you move your head to the side this way, to the side this way. Oh, yep, go ahead and roll your head around just like that. Is that causing you any pain or discomfort?
No.
I'm going to have you go to the side, and then I'm going to have you look. Turn your head and look this way. Yep, perfect. And then look this way. Awesome. Can you shrug your shoulders for me a couple times? Awesome, that looks great. I'm going to palpate your lymph nodes. I'm going to just start in the front of your ears. Feeling for any grape sides, pea sides, little nodes. I'm going to move behind your ears. And then kind of down your jawline, underneath your chin, and then down. So nothing feels abnormal. I'm going to have you turn your head this way, and then turn your head this way. Great. I'm going to feel above your collarbone, your clavicle, and below your clavicle. On the other side, underneath. All feels great, and I'm just going to feel the back of your neck. Not feeling any lymph nodes that are swollen or enlarged, which is great. I'm now going to feel for your thyroid gland. I want you to just look at me. I want you to just swallow normally. Awesome, and I'm going to just palpate your thyroid. And then I'm actually going to stand behind you. Just keep rest your head normally. And then go ahead and swallow for me. Perfect. Go ahead and swallow again.
So Janet, I'm going to be your occupational therapist today. Hello. All right, so we're going to be looking at the range of motion and muscle strength in your wrist, thumb, and fingers today, okay? Okay. Okay, so I'd like for you to start by bringing your wrist forward as far as you can, like this. Okay, is that as far as you can go? Mm-hmm. All right. Okay, and now I'm going to push down a little bit. Okay, now I want you to bring your wrist back like this. Okay. Okay, now I'm going to bring it down. Okay, I want you to start by bringing your wrist towards your pinky like this. Excellent. Now I'm going to move it. Okay. Okay. Now I want for you to bring it back towards your thumb like this. As you can you keep your hand flat for me? Bring it all the way over. Okay. Okay, now I'm going to move it. Okay, thank you. Can I start with you making a fist like this for me? Okay. Now I'm going to measure all through right here, and then I'm going to push down after I make the first measurement. Okay. I'm going to write those numbers down really quickly. Okay, now I want for you, again, after I make that first measurement, I'm going to push down on your fingers. Okay, I'm going to measure right here. Okay, I can lift up your thumb for you. Now I'm going to put this right here on the crease of your hand, and I want for you to touch the tip of your finger to the bottom of the measuring stick as closely as you can. Good job. Excellent. Now we're going to look at your thumb. So to start off, I want for you to put your hand like this and bring your thumb out and make an L shape as far as you can. Okay. Thank you. I'm going to push on it a little. Thank you. All right, now I want you to put your hand flat on the table and bring your thumb out as far as you can. Okay, I'm going to push it out. All right. Okay, now I want for you to bring your thumb in towards your palm like this. And can you tuck this part in a little more? Okay. I'm gonna push it in. Okay, now are you able to touch your thumb to each of your fingers like this? Excellent, thank you. So now we're going to look at your wrist strength. So I'd like for you to start by putting your hand face down on the table like this. And I want for you to lift towards your pinky as far as you can. Okay, hold there, don't let me move you. Okay, now you bring it back down. I want you to bring it up towards your thumb this time. Okay, I'm gonna move your thumb. Hold there, don't let me move you. Okay, you can relax. Okay, now with your hand facing down, I want for you to lift towards your pinky. All right, now hold there, don't let me move you. Okay, now what I'd like for you to do is bring your elbow back like this and lean forward. Okay, now I want for you to lift it towards your thumb again. And then move your thumb over, hold it there, don't let me move you. Okay, now you can come up and bring your elbow forward again. I want for you to bring it up again, this time towards your thumb again, and hold it there. Don't let me move you. Okay, thank you, Miss Hood. You can relax. Since you're not able to lift your wrist, we're going to go ahead and eliminate the effect of gravity. Can you please put your hand on the table like this? Okay, now I want for you to bring it forward as far as you can. Okay. Hold it there. Don't let me move you. All right, put your thumb. Hold there. Don't let me move you. All right, now I want for you to bring it back as far as you can. I'm going to try to bring it back in this way. So I want for you to hold it there. Don't let me move you. All right, can you lift up this finger for me? Okay, hold it there. Don't let me move you. Okay, lift it and hold there. Don't let me move you. Good. All right, lift, hold there. Don't let me move you. All right, and lift, hold there. Don't let me move you. Okay, thank you. Okay, now I'm just going to be testing this little joint right here. So if you can lift for me. Okay, hold there. Don't let me move you. Lift and hold there. Don't let me move you. Lift, hold there, and lift and hold there. Don't let me move you. Excellent. Okay, now I want for you to lift all of your fingers up at once, like this. Excellent. Okay, hold there. Don't let me move you. Hold there. Don't let me move you. Hold there. Don't let me move you. Okay. And hold there. Don't let me move you. Okay, thank you. Okay, now I want for you to make a claw hand like this with your wrist resting on the table. Excellent. Can you bring it forward just a little bit for me? Okay. Now I'm going to try to push your finger back out. So hold there. Don't let me move you. Hold there. Don't let me move you. Hold there. Don't let me move you. And hold there. Don't let me move you. All right. Thank you. Okay, now I want for you to make a longhorn sign like this. And I'm going to test both of these two fingers. I'm going to push down right here, so hold there, don't let me move you. And hold there, don't let me move you. Okay, thank you. Okay, now I want for you to put your palm face down on the table and spread all of your fingers out. All right, I'm going to try to push this finger in, so hold there, don't let me move you. Okay, now are you able to move your middle finger towards your ring finger? Okay, I'm going to move your ring finger over a little. Hold there, don't let me move you. Okay, now I want for you to bring your middle finger towards your index finger. Okay, move your index finger over a little. Hold there, don't let me move you. Okay, I'm going to try to bring this index finger in, so hold there, don't let me move you. Okay, thank you.